Hello, this is Dr. Drew Hall again with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is going into menopause early. Some women can go into menopause as early as 40 years old, yet another one goes into menopause when they're 58. What's the difference? Well, I'm going to give you my opinion. After being in practice for 18 years and seeing about 11,000 different patients, we've seen the gamut when it comes to problems that people are dealing with. The difference between someone who goes into menopause early versus someone who goes into it late is health. We know that some women who have had cancer and have repeated chemotherapy treatments, they can go into menopausal transition rather early. And we also know that that is due to the toxification of the system and the outright annihilation of normal function in the body. You can't put poison into it without certain things happening. So we also know that from the 18 years that we've been in practice that we've had many women, albeit some of them haven't been so happy, that have come into the office for a certain condition and we've gotten their upper neck corrected to reduce the irritation on the spinal cord. And lo and behold, some of these women that have been menopausal for 3 or 4 years and haven't had a menstrual cycle all of a sudden get their menstrual cycle back. We've seen that well over 100 times with differing patients. So while the patient may be a little bit upset having to go through that again, I always remind them that, well, you're younger. We're making you younger, right? I mean, going into menopause and stopping your menstrual cycle is a sign of aging. And again, if you're doing it early, it's an indicator that the integrity and the health of your system may be lacking. Now, what we do in our office is onefold. We're experts at determining whether you have one of these upper cervical vertebra that is misaligned from a prior injury, whether it's a car accident, a sports injury, a slip and fall, a blunt head trauma. Those types of traumas can cause the atlas. This is the top ring-shaped vertebra. It's about 2 ounces and it's right where your head rests. It's most vulnerable to injury. So the craniocervical junction, which is the junction between the head and the neck, is very susceptible to injury because of its biomechanics. And so if the person has sustained injury and that top vertebra has become misaligned and locked out of its normal range of motion, it impacts the nervous system. It decreases the overall health and function of the body. And the more irritation there is, the more interference there is to the system, the more trouble that people are going to have. So if you're someone who has gone into menopause early, if you're someone who has irregular menstrual cycle and you're not in your mid-50s, if you're someone who goes 3 months and has your period and then goes another 6 months, you might want to investigate this upper cervical work because it does have a profound impact on the central nervous system, and the central nervous system controls the endocrine and hormone system. So what do we do if you did come into our office? We run the patient through a battery of neurological tests to determine A, do you have an upper cervical injury? B, if you do, which bone or bones are misaligned? And C, once we know how you're misaligned and the patient's ready, we take 3D imaging to see how the joints fit, and by looking at each individual joint we can tell exactly how that vertebra is locked out of position, so we can then make a precise correction to get the segment back under the body's control. And then we monitor the patient over a period of time, and every day that nervous system is clear of that structural irritation and interference, the body naturally will start to right itself. So if you're in the Los Angeles area, we have 2 offices. We offer a free consultation in the office. Our Los Angeles office number is 213-399-7772, and our Carson office number is 310-324-6172. If you're outside the Los Angeles area, you've come across this video, it makes sense to you, you've been worried about why you have gone into menopause early, you have a very irregular menstrual cycle and you're interested in this, but you're too far from LA, call our office. We'll find you someone in your location that practices the work that can help you out. Thanks for listening.